So hello and welcome to another episode of Inspired Men Talk. And today we're incredibly lucky to have a wonderful guest, Claire Noyell, who is a fellow hypnotherapist, but also a pharmacist. So Claire, tell us a little bit about yourself.
Hello. It's really nice to be here, actually, having listened to all the podcasts, proper fan. So it's nice to actually be included, particularly as I'm a girl on a men's podcast. So, as you introduced me, I am a solution focused hypnotherapist, but I started my working life as a pharmacist. I've been a pharmacist for 30 something years, working in community pharmacy, the kind of place where you pop in to get your prescriptions and buy your hairspray and all that kind of thing. So that I did for many, many years and got a little bit disillusioned with it. I felt like I was seeing the same people over and over again and they weren't getting anywhere. So through a series of random kind of coincidences, I ended up doing a solution focused hypnotherapy course and realized that the work I was doing with my clients, even as a student, was probably making more of a difference with some of the issues I was working with than the pharmacy stuff. So gradually switched over my working week to more hypnotherapy and less pharmacy. But I still do 1 day a week in a nice little community pharmacy nearby.
Oh, lovely. Now, when I was growing up, Madness did a song called House of Fun.
Yeah.
And yeah, that was all about boys or young lads turning 16, going into the pharmacy to buy condoms. And it was a very kind of, big thing. And it was a really difficult thing, certainly growing up now. And now we know that it's a lot easier to buy those products. There's a lot more places that you can get them. But has that changed in the pharmacy industry at all? Do men, when they're coming in to buy men's products or any kind of thing, has that kind of embarrassment thing changed? Is it still the same? What have you noticed as your time?
I think there is still a level of embarrassment about some things. So, for example, we now sell Viagra over the counter. It's a different dose to the one you can get on prescription, but the idea is to open up access to men experiencing those kind of problems with erectile dysfunction. But clearly, because it's quite potent stuff, I need to ask a few questions about it, and they don't want to answer. And I have a suspicion that talking to a female pharmacist, they'll walk in, see me, and go, "Oh dear me, no." And they'll go and come back another day when my boss is in because he's a man. And that's an easier thing for them to get their heads around potentially.
Yeah,
That's not true all across the board, though, to be fair. There are some people who will be a little bit more open to it. And I don't know if that's a confidence thing or an embarrassment thing or a desperation thing, that they will actually suck it up and come and talk to me.
yeah, I know from my experience, kind of the purchasing of the condoms was a bad thing, and then I've got better as I've got a bit older. But what about the other chaps here, Gary? What about yourself? When you go into the pharmacy, is there stuff that you kind of feel a bit awkward talking about, or anything like that?
No, I think interestingly, I come from a huge family and I've got 5 sisters as well as brothers. So it very quickly, whatever was happening, everybody knew. So we didn't have that same sense of pride or the same sense of vulnerability or whatever we might call it. So I don't think I ever had a problem with anything like that. But it was very, I mean, even all the jokes on television was about, not, going into the pharmacist and buying something completely different. They've made films, sketches about it. So, but I've got another question, but actually it's for Peter, not for Claire. When Madness played on the roof of Buckingham Palace, did they play
Right.
that song?
Oh, I don't know. I didn't see him do it.
Because I just thought that would be playing a song about the House of Fun, but it meaning something different would have been completely. How many people would have caught up on the pun?
Only if Prince Andrew was there, probably. But
Yeah.
anyway.
Well, stop. So
What
no,
about,
I didn't.
okay. And what about yourself, Chris? Have you had any kind of, when you go to the pharmacy, have you had any issues where you've had kind of, you feel uncomfortable talking about what's going on?
Personally, no. And I mean, I would actually feel a bit different to the way Claire's describing it. And I don't know if maybe you see a little bit of this as well, Claire. Particularly if I was ever in the need to buy something like Viagra or anything like that. I don't know if I would feel better talking to another bloke about it, or maybe a woman actually. I would probably think that a woman would be easier to talk to. I don't know if there's this, if I talk to a bloke about it, he knows that I'm struggling or something, and you know, where would the banter begin, and is that bit more of a damaging thing with your pride? Whereas I think I would feel a woman would be more empathetic and understanding.
No, I would say there's probably an age difference. Obviously there's no age limit on who might need some support with something like that. But I do find that maybe younger guys are more willing to talk about it, and I hadn't thought about it from that perspective, Chris. So that may be why. But I still feel like we don't sell as much as we ought to, given the need that I know statistically is out there. So I imagine there's a fair few people that don't want to buy it over the counter, that don't want to have that conversation for all the reasons that you've maybe mentioned, embarrassment or shame or some kind of link to their manliness, and would rather buy something off label over the internet so they don't have to have that interaction. I suspect there's a fair bit of that goes on, which is a shame because it may not be what they're looking for. It may not be exactly what they've ordered.
And Ben, what are your thoughts? Have you ever had that situation where you've gone into the pharmacy and you've kind of felt a bit of embarrassment about anything that you've had to do, or is it different for you coming from the gay perspective? Is there a different kind of thing there?
So I think for me, no, but I think it potentially does come from the gay world, because there's a bigger emphasis, I feel, that on your sexual health and getting screened and everything else. And if you ever go to a gum clinic and and go through that questionnaire with someone from a gay world, the questions you get asked cover a whole range of actions in community that probably go far deeper than people's minds can even imagine, if you're not aware of the layers of our community and the different types of scenes that are available to it. And, from anything from chemsex to other sports. Going to buy a pack of condoms after you first experience that for the first time is like going to the shop to buy pick and mix. It's not really an issue. And it's never been an issue. But then again, I've never been and bought some, because you get them all free when you go to the clinic.
Wow. So you're a cheapskate.
But you're getting them for free. Why not?
I mean, I've never had to buy them. It is, like you say, our generation it's been more available.
You've got 3 children. Maybe you should have bought them.
It's probably generational as well, because I think it's the younger generation now go to clinics freely, like without it being a big deal, where I think for the older generation, that would still be a really uncomfortable experience. And I always remember when I worked at Sainsbury's, and we have every year the Christmas aisle comes in, and there's always guarantee some Christmas box of Durex that's stacked to the hills with something.
I never noticed that.
As a present. It'll be there somewhere on the aisle. And there was always someone who we used to sort of make the fun of was always sort of the shagger of the team. So I remember picking a box of those up and taking them to the till as a joke present for Secret Santa, and the older lady on the checkout was mortified. Absolutely mortified as I put this massive box of them there, and she goes, "My God, what are you doing with all them gazongas?" And it's like, gazongas, is that what you call them? It's like, but yeah, she was horrified that I was buying them. So I think generation is a big player in it.
I think they used to be called Geromanos or something like that, and you used to have to wash them out after use.
I mean, that's showing your age, Gary. That is
not that much that.
Yeah,
that's showing your age.
I'm not sure if there was ever any sexual health value to them at all.
No, I think that's a good point. That awareness of sexual health is probably higher amongst younger people, because I've noticed that the younger generations are quite happy to come in with their wives and partners and girlfriends and ask for stuff like the morning after pill, which traditionally they would have hidden around the corner and not got involved in that. But I noticed there's more of an awareness there, which is quite nice. But I think Peter's right. It is quite a generational thing.
That's just made me think of a completely different question, which I'd never thought I wouldn't have thought of. Do you think men are taking more responsibility when it comes from pregnancy point of view? So condoms is a man's responsibility in a way to make sure everybody's safe and they're not getting people pregnant. The morning after pill, it wasn't available in my youth and when I was in that sort of age group. Now you can, if you feel you need one, you can go and get one apparently. But do you think that was always a girl's problem? If you get pregnant, that's your issue. You know,
Yeah.
you should have took the pill.
I think there's more of a partnership I'm seeing, certainly with youngsters. And I'm talking like under 18s when I say youngsters. So when they come in, it's not uncommon for their other half to come in with them.
Wow.
Which is nice. I've never seen that with older women coming in, because again, it's not age restricted. If you're able to get pregnant, you're able to buy the morning after pill. So I would say I think boys are probably trying to take more responsibility, but to be fair to them, they are quite limited in what they can do. There is no male contraceptive tablet as yet, so there's a limit as to what they can actually be responsible for.
No, but they know what they
Absolutely,
should know the consequences of their actions. And it used to be
there's an awareness of that as a possibility, whereas before it was, as you say, very much, well, you go and get something, love.
Yeah.
It's
well, it was a case of, I don't have to look after myself. If you get pregnant, that's your responsibility. You need to protect yourself. I don't have to. And maybe that's a really old-fashioned idea, but hearing the fact that there were young men going in and supporting their partner, they've made a mistake, they've done a joint mistake, and they've gone in and both held up their hands and said, "Can you help us?" That's really good news from my point of view. That never would have happened.
It always makes me smile, and not least because it gives me the chance to do my Auntie Claire bit and just have a chat to them about sexual health and stuff generally, because that's a big deal, and I don't think schools teach it in the same way that they probably need it to land. It's a bit embarrassing. So yeah, I do my Auntie Claire bit and talk about what to do next. As Ben said, go to the gun clinic, look at your other options, a little bit more educational and awareness for everybody.
Did you just call it a gum clinic?
Genitourinary medicine.
So again, I've never heard that term. So a gum clinic is where we used to call it a clap clinic.
Yes, let's call it a sexual health clinic, shall we? Let's move
no, that's what I'm saying. So I'd never heard that term, so I wouldn't have known. Okay, thank you.
It's interesting because you mentioned education in schools, and I always thought, it was awful, it was embarrassing being there. But actually, while everybody's talking here, me and Ben obviously had those barriers broken down a little bit more because we went through a lot of that at school. Whereas Gary's generation, even Peter's generation, perhaps didn't get those barriers knocked down at such a young age. Because, like you said, I will go to the sexual health clinic and get tested without even batting an eyelid if I think it's necessary. I will go and buy whatever I need to from the pharmacist without worrying about it. And I think that's a credit to, even though it was cringy and it did make you giggle and make everybody feel silly, it clearly did something, because you're now starting to see those effects coming through.
Yeah, really important.
Yeah, and it was definitely different for me. So yeah, I definitely didn't like talking about sex at all. It was a dirty word, and I think we covered it in a conversation once before on here.
It was a real taboo, and yet it's what everybody's doing. It made no sense, but it was this sort of perception that it was wrong if you mentioned it in public. Oh, you don't talk about that. You're on mute, darling.
That applies to lots of different forms of health, doesn't it? I think sexual health is a big one, but I think it applies equally to mental health. And that's why I love the fact that you guys have been doing the podcast, because that's very much changed. And there are lots of elements to mental and physical health that are inextricably linked. You can't be physically healthy without being mentally healthy. So I think it's a real misunderstanding to think about those two as separate issues.
No, but I think when people are mentally unwell, they're more likely to not look after themselves and not take responsibility for their sexual health and their sexual activities as well. So there is a link, but there's also a negative link if they're not careful as well. So that education, what Christopher was talking about, is helpful, but actually, how easy is it to get support?
Well, that's the frustrating thing. And I'm very lucky that the pharmacy I work in, he is particularly happy for me to talk about what I do. My leaflets are openly on display, so that if somebody comes in looking for mental health support, I know full well there are limits as to what the NHS will provide. There's, you may have heard of IESO, which is the online support one. You've got various kind of self-referral links there, but they take ages to actually access. If people are looking for mental health support here and now, there's a limit as to what I can refer them onto. I can give them phone numbers and I can tell them how to get help, but unless they are immediately in crisis, there's a limit as to the amount of effective support they'll get. So I love the fact that my boss is happy for me to go, well, actually, stepping out of my pharmacy world and into my hypnotherapy world, that's something I can support you with. Let's have a chat.
Well, why doesn't the pharmacy support it?
Because there's nothing to support them with. I can give them information, the signposting thing that you do. I can send them back to the GP, but I know 70% odd, I forget the actual stats, but some 70% of appointments at the GP are actually to do with mental health rather than physical health, because that's your first point of contact. I can't refer anyone on directly to the mental health team. There's no pathway for that.
Wow.
As the pharmacist, you guys will handle the medication for people who are on antidepressants in any form. How do you, although you can't prescribe them directly, what support can you offer to people who are already on antidepressants but maybe struggling still? I mean, what does that conversation go like?
Oh, that's really interesting, because this is where being a hypnotherapist is really helpful. And the two worlds collide really nicely. As a pharmacist, I tell people what they can expect from taking their medications. You know, they might make you feel a bit sick, they might make you feel a bit sleepy, but keep taking them. That's standard advice that a pharmacist will give you. If it's not working in 3 weeks, have a chat to the GP. But as a hypnotherapist, I tend to go a step further and talk about some of the actions that people can take that will make their antidepressants work better. So on your podcast, you talked about the importance of interactions. I've talked about doing stuff. There's all sorts of things that we talk about as therapists that are likely to make people's antidepressants work better. So there's a definite bit where those two worlds mesh, and we can support people in a much more effective way. So that's really nice.
So with prescriptions, I have a friend and he's an account manager for a number of pharmacies. And he has said that, you know, when I was growing up, the front of the pharmacy used to be the major part where you'd sell your toothpaste and all your other little bits and the combs that you'd buy instead of condoms. But he said now it's changed and the fronts of the shops are getting so much smaller because they're seeing an increase in prescriptions. Have you noticed that we've had more prescriptions recently? Is that mental health related, do you think?
Oh, yeah, definitely. So you may have come across the drug sertraline. It's one of the most prescribed in the UK, and I think it takes up about 40% of the budget for antidepressants. It's really widely prescribed, and antidepressants make up a huge chunk of medication generally. So yes, definitely an uptick in the numbers of prescriptions supplied for that, particularly over COVID. I think that changed the landscape. People that were struggling before were probably struggling a little bit more then, and so prescriptions went up. But unfortunately for the NHS, the cost of that has also gone up. It's quadrupled in that last 5 years or so. So the budget that the NHS is having to spend on medication to support people who are depressed or struggling with mental health problems is taking up an ever increasing chunk of their budget. It's getting to be a big problem, I think. And while the pharmacies have been given permission recently, there's a whole new program you guys may have come across it, Pharmacy First, where you can rock up to the pharmacy if you've got a sore throat, or if you, not you guys, but the girls can go if they've got a urinary infection, children can go if they've, well, not on their own, but with parents, if they've got an ear infection. There are conditions that we can now supply medication for. Mental health is not on that list. And there's an argument that maybe with some adequate training, it should be, because pharmacists are a really nice, easy port of call. There's one on every single high street in every village in this country. And I feel like while they're happy to use us to prescribe antibiotics, the need and the kind of drive for us to support with antidepressants and mental health isn't being recognised. I mean, don't get me wrong, we're busy people. There's a lot of stuff going on in your pharmacy, but if they're going to want us to support people's health, I would love to see mental health on that list too.
Absolutely. I was wondering when you're talking about the difference, when you're talking about the antidepressants and the bit of support you can give, do you find, as we're talking about men's mental health, do you find that men come to get things like that checked just as much as women, or is there a difference, or, you know, what happens there?
No, I don't think they're as open to having the conversation, because quite often, if I've got time, I'll give someone their prescription and go, you know, here's your medication, they're giving you 2 months worth. How's that working for you? Which again, I think as a pharmacist, I'm unusual in that. Most people are just kind of like, crack on with it, I will ask people, how are you doing with that? Because I'm quite comfortable talking about people's mental health in a way that I think a lot of people are a bit scared of opening that conversation. But most blokes like, yeah, it's fine, bye. There's not the willingness, whereas some of the women might go, well, it's kind of okay, but I'm struggling with this, it's not really doing that, so we'll have a conversation, I'll send them back to have that reassessed. But I do see people buying over-the-counter meds for sleep stuff, which is, as you all know, is often a big marker of someone's mental health not being where it should be. Poor sleep is definitely something that predicts or is part of poor mental health.
It's really interesting about that whole men not talking about how the prescription is going, because when I was growing up, and I don't know if it's true for Gary, my perception was if you needed to talk about your medication, you went to your GP, you just collected it from your pharmacist. It was kind of like your Amazon delivery point almost.
Yeah.
So basically that's changed now, right? So I guess through training, there's a lot more availability to talk to your pharmacists now.
Well, you don't need an appointment for us, do you? You can just walk in, hang around, you can go look at cotton wool, or you can go and rummage through suntan lotions for 5 seconds until you pluck up the courage, or there's no one else in the shop. And then you can have a conversation with us. We are easily available, we're easy to find, and we don't need an appointment to go, by the way, while I'm here buying this paracetamol, can you tell me about this? That's possible in a way that making an appointment with your GP is just not.
Yeah.
I think
but we are limited what we can do.
I think that's an interesting point that Peter makes, is that it's changed. But I'm not sure it has it, Claire? I think that pharmacists have always been trained to do all of that. I just think it's the position of it and the marketing around it has changed. But I think people really underestimate what pharmacists can do and their skill set.
Yeah, I think so. I mean, the vast majority of pharmacists don't prescribe. My boss there is unusual. He runs a separate prescribing clinic, which means that he can write prescriptions and give different things. There's a limit as to what I personally can supply without a prescription. That's a slight difference. But Ben's right. We've always had the knowledge to give advice on medication. That is our primary role, as I see it: preventative and supportive healthcare, helping people to make the most of their medications. What's the point in a medicine if you don't know how to take it? If it's not working for you, then it needs changing. If it's working for you but giving you side effects, it needs changing. And that's the point that pharmacists are, in their little box, definitely able to do. But it would be really nice to think we would work better alongside GPs, because I think they don't make the most of us as fellow professionals.
I've got a slightly different opinion, and it might be through lack of experience, because I can't remember the last time I needed to go to the pharmacy, apart from collecting my regular drugs. Yeah. But when I used to go there, the person on the front counter behaved like a gatekeeper. I guess emails the prescription to the doctors, and the doctor, the chemist then delivers it. And so I don't even know if I've got a pharmacy. It comes from, I know where the local pharmacy is, but I've never been in there. I spoke to them on the phone. That was it.
No, there's a whole load of online pharmacies. A lot of them are off. They're off the high street in a warehouse somewhere. Your prescription gets sent there electronically. There's minimal input from a pharmacist other than checking the accuracy of what comes out.
But that's basically what I've got. Even though I know where the pharmacy is, they might be handling it to somebody else.
Yeah, and that's a shame, because you miss out on that interaction. I mean, maybe you personally don't need it, but older people, someone will go to you, you're not looking quite so well at the moment. Is everything okay? Can I help you with anything?
This is where I'm waiting for
the intermediacy of us.
This is where I'm waiting for a jibe from somebody else when you said older people. No, but I'm quite lucky I got away with that.
We knew you'd pick up on it on yourself, Gary, so it was fine. And you touch a little bit there, Claire, on the delivery side of the legitimate pharmaceutical stuff. But what about then, there's a lot of black market drugs available now, isn't there, as well?
Shockingly, it's actually quite easy to get hold of medication without a prescription. I've seen, especially just before COVID and during COVID, I've seen adverts on Facebook, not adverts, but posts on Facebook in community groups. If anybody wants some pregabalin, I've got some. If anybody wants some diazepam, I've got some. Those are anti-anxiety meds. And there's no way they should be given to people without a prescription and a proper hardcore conversation with your GP about what you're doing. But they're disturbingly easy to track down if you're happy to take something and not ask too many questions.
And if you're a member of parliament, you sometimes just give them to your kids. Yeah. So
I clearly missed that one, but it's.
I think I can't remember whether
Well,
she
you're
was the
dishing
health.
them out today, Pete, aren't you?
Well, I can't remember if she was the health secretary or not, or something. I can't remember what it was, but yeah,
She was
talked
definitely
about,
someone who should know better. Yes.
yeah, and
But-
she basically said she was giving her prescription stuff to one of her kids or one of her friends or something. Yeah.
But I know someone who gets extra migraine pills on the internet.
Mhm.
They get their issue from the GP, but they haven't been able to get into the GP, haven't been listened to for a number of years. It's just like, yeah, and they don't, there's no checkup, there's no follow-up, and they have to have them because they suffer so badly.
But the flip side of that is that what's prompting those migraines? Why is she having more of them than usual? Is it to do with the level of stress or overwhelm or something else that's going on that someone should be getting involved in and going, well, hang on a minute, you seem to be, this has got worse for you. What's precipitating all this? That could well have links to a mental health condition, and it needs
Absolutely.
looking at rather
But now
than
it's
just.
easier to just go online.
Sadly, yes. And I think that's where you miss out that personal touch. That somebody being involved and going, is everything okay? And I think that's particularly important, as we've said a couple of times, for people who won't bring that up themselves.
I think,
If you've
Claire,
got somebody lurking, if you've got someone lurking in the pharmacy and you can sense they kind of want to ask a question, but they won't come up to the counter. Is everything all right? Did you want something?
I mean, I think the way you're talking about it, Claire, it would be fantastic. But I think there's a lot of people, self included, who haven't had those best experiences. Like you say, you go to the GP or your pharmacy and you're with these issues and wanting somebody to look at you a bit more, and they just don't. They, however, haven't got the time, or they're under too much pressure, or they, from a personal perspective, they almost see you as another person just complaining, and they just haven't got the time for it, you know. And we don't. I think there's a lot of people out there who will share those experiences, and it almost does break down that trust, doesn't it? I mean, it'd be great if everybody had a pharmacist like you on their corner, but unfortunately, that's just not the case. And certainly, when you get to the GP, they do miss a lot. You know, they haven't got the time to look into deeper, and certainly you don't get the same one twice.
Absolutely. I'm very lucky because I started my whole pharmacy career in a teeny tiny pharmacy as a Saturday kid with an old school pharmacist, complete with white coat, who knew everyone that came through his door. And that's how community pharmacy has always felt to me. So even though I work for some of the bigger companies like Boots or in local to me, Paydens, I still managed to hang on to that kind of community feel because they were in little high streets in towns. You go to a pharmacy somewhere in a big shopping centre like Bluewater or Lakeside, there isn't that sense of community. It's much more transactional and you don't get that individual rapport with people. One of the bits I loved most about the pharmacies that I worked in was the fact that we often had a fairly big population of drug misuse clients that you saw every day for their methadone replacement stuff. I loved working with them because you were the only person they saw on a daily basis and you were the one that could go, how's it going? Is everything all right? And I loved that because how I'd experienced my own pharmacy as a kid, that felt the right thing to do for me. I really enjoyed that. But I think you're right. You miss out in those big impersonal pharmacies that are in shopping centres or the ones that are remote that Gary's mentioned. You don't get that. And I think that's a real shame.
And I appreciate the pressures that are in those environments nowadays, but I don't think it takes a lot. And I think it only takes a little bit of training, maybe, or a little bit of awareness, because I can tell you two occasions, very different, very wide apart, where I've gone to the GP because I've been depressed years before I became a therapist and things like that. But there's two occasions, and they're so different. Because the first time I went, it was, this is how I'm feeling. And it was very much, the guy was not even looking at me, just typing on the computer the whole time I was talking. And just, when I finished talking, handed me the prescription and said, there you go, thank you very much. Whereas the second time, and do you know what? I took them for about 3 days and then said, I don't want these anymore, I'm not taking them, and just moved on. Which obviously, as you know, not enough chance for them to make any difference.
No.
And then a couple of years later, I found myself in a position and I went again. And this time, the GP took the time to look at me and said, so looked at my thing and said, so you've got children? He said, yeah, I've got children. How old are your children? You know, talking to, nothing to do with about why I was there, but it was to do with why I was there.
Yeah.
He engaged me in that conversation, and he gave me a reason to want to get better, and then said these
That's
things,
ideally how it should be.
yeah, and then he said these drugs, they do this will help, and he made that effort, and I stuck with those ones more because he made that little bit of effort.
And I think that's really key. But unfortunately, as Gary said, because of that workload, that your GP has got about 8 minutes to see you, write his notes, prescribe something, and move on to the next person. Pharmacists, as Peter said, are often stuck doing fairly banal stuff like checking prescriptions, which is not particularly fulfilling, I can tell you. But we don't always have the time and space. So I think there is definitely room for a sort of a rejig of the health landscape that people have got access to easily to make it more accessible. But I think also maybe there's an expectation that people should ask questions, that they need to actually take a little bit of more a proactive approach rather than just kind of sliding in and going, I've got backache, and by the way, just as you walk out the door, I've not been feeling great either. That's the wrong way to think about it, because by that time you've lost your 7.5 minutes and you've got about 5 seconds left before the next person comes in. So I think there is an element of, if people want to get the best out of the landscape, the NHS and the services it has, you've got to be a little bit pushy. The sad thing about that is if you're not feeling mentally robust, that's really hard to do.
And I think one of the things I was going to ask, because we've talked about the difference between men and women in pharmacies, and you've said that women are a little bit more kind of forthcoming with stuff. What advice, because we are all solution focused in what we do, so what advice can you give to men about visiting their pharmacies, about taking care of their medical or mental and physical health? What advice would you give to say to men, you can do this? Because a lot of it, we don't really know what we can do and how far we can go. That piece of advice just there saying, focus on the thing that's important first with your GP. That's fantastic, because I'm very much one of those people that will go, oh, I'm here because I've got a bit of athlete's foot. Oh yeah, and by the way, my left arm doesn't work, or something like that, right? Leave the big thing to the last. So what kind of advice can you give to men to sort of help us, certainly for people my age, help us understand what we can actually get out of visiting our pharmacies?
Well, the first one is speak up. There's a lot of people in that pharmacy who can help, whether it's the lady on the counter, who I promise you has got really good training in how to deal with stuff over the counter. If she doesn't think it's in her remit, she will pass you on to the pharmacist. So ask the question. But I also think it's about kind of being open. I know you guys have had this whole policy of making sure you talk, but just ask the questions. There's a lot of stuff that we can do for you, but I can't point you in the right direction or give you the best advice unless you tell me what it is that you're actually here for. So asking for stuff for sleep is usually a little bit of a clue for me. If someone's asking for sleep, yes, I can have a chat to you about what else you can do to help with your sleep, and that's something that is often supportive. But ask the questions. That's the first thing, because there may be more that pharmacy can do for you. Particularly now as we're sort of expanding out what we can do, it may be that we can signpost you onto a specific clinic. We had the guy that I work with does a hair loss clinic, a weight loss clinic, a vaccination and kind of B12 support clinic. All of those are add-ons that you may not know about. So ask the questions. But I think even before that, the biggest one is don't leave it so blooming late. You guys will just go, oh, it'll go away, it'll go away, it'll go away. And it's not just athlete's foot at that point, it's leprosy. So don't leave it till the last minute. When it starts to become a problem, go chat to somebody. I think that's probably the biggest difference. Women will go, oh, I've had this little thing for a couple of days. Blokes will come in, oh, I've had it about 1.5 years. And now I've got a problem because something over the counter isn't going to cut it.
You're talking about early intervention.
Early intervention,
which is what we always talk about. If you look at any mental health condition, it always says the earlier you can get to this, the more chance you can get a speedier recovery with physical health too. And one of the biggest challenges, and probably again, I'm of that sort of era where that's you talk to the GP. If you've got an issue, you go to the GP, which is harder and harder to get to see, etc., etc. They've got this pharmacy first thing going on now. Actually, should we be adopting, do you know what, if we're just not feeling great, speak to the pharmacist, because if you need more, they will point you up. So that chain you're talking about, talk to that lady or gentleman on the front counter who's not a pharmacist, but they do know more than you think, who will then upgrade you if they feel they can. If it's out of their remit, they'll upgrade you to a pharmacist. Is a pharmacist the best point of call then to get a better understanding whether you need to go to see the GP or whether there's something you can do yourself?
Yeah, I think that's a really good assessment of it. We're easy to find, we're easy to see, and we probably know more than you give us credit for. So yeah, don't leave it to the last minute. Go and chat to them. And if we, genuinely, if we can't do it or if it needs a prescription, don't worry, we'll send you to the right place. But come in and chat to the pharmacist about all things mental, all things physical, maybe not all things spiritual, but I can find somewhere for you to go for that too.
So you're an attractive lady, and I've got an issue which I'm uncomfortable talking to about. What can you say to me now which will blow away all my reserves? Because
we've probably seen it before.
So there's nothing I can tell you which is going to shock you. Is that what you're saying?
Not. I've been shown probably every body part that you guys possess in my time as a pharmacist. I've seen photos of it that I'm not quite sure what angle I need to have it at. I've seen it in 3D, and it's fine. There's always a consultation room. Don't think that you're going to have to drop your trousers in the shop. There will be somewhere quiet you can go. Nobody's going to ask you to strip off in the middle of the aisle. All pharmacies are required to have a private consultation area. Some of them, if you're really feeling a little bit like a sensitive flower, may even have a male pharmacist that you might be more comfortable with. But I really liked Chris's point that sometimes you don't want to be with a male pharmacist. A female might be slightly more approachable.
It's really strange. I actually would prefer also seeing a female and talking about my challenges. You all know I've been through bladder cancer. I much prefer it when I get a female doctor to deal with my issues and inspections, you might say, than having a male doctor. It's really weird. That's me.
Is that because men respond to you differently? Do you think that's because the male healthcare professionals deal with things in a different way to female healthcare professionals?
Yeah, there's maybe more compassionate and less judgment, but that's probably me more than them. But what I think the thing is, what stops me or would stop me if I'm one of those people who actually would drop my trousers in the middle of the supermarket or in the middle of the pharmacy. And I think
Gary, we don't need that here, mate.
But that's
against the law, mate.
All three of you would do the same. I know that. None of you have got so much pride you wouldn't do that. But actually, most men would find it quite uncomfortable talking generally about anything to do with health to a pharmacist, because I don't think you're as experienced as a GP.
I think the thing to think about that is we look at it from a different angle. GPs are trained for many, many years in the actual organic underlying disease. Pharmacists have a shorter training period. It's 4 years as opposed to 7 or 8. But our speciality is drugs. We know what medication is for what thing. So if you're struggling with, I'm not feeling quite right on my medication, I think it might be a side effect. It might be something that's not quite being dealt with. That's our specialty. So it's not an either or. It's as well as we should work well together. But I think the understanding, and that's probably down to the pharmacy governing bodies, is they've done a really poor job of getting that across to people. We are seen as these little kind of ninjas or minions in the back in a white coat that you get a piece of paper and a few minutes later your medication arrives, and we kind of don't have anything to do with it. We're just invisible. But we're not. We love talking to people for the most part because we're bored of checking prescriptions. Give me a real live person to have a conversation with and see the end result of what I've just done.
I want to emphasize that a little bit for you, just the importance of a pharmacist, because I think that's a really valid point that people really underestimate. So every NHS ambulance trust will have a medical director who is a doctor, and that will advise them on their clinical interventions and things that they can take. But they all have a pharmacist, and the pharmacist has to advise the doctor and the medical directorate on the drug interactions and side effects, and they rely on that pharmacist for that insight and knowledge. So they both have a substantial amount of weight, but as Claire says, drugs is their speciality, and that's sometimes better than the knowledge of your GP.
Can I take that a little step further? Because I think you're right, but I know nothing about the ambulance service and nothing about the medical profession. But I do know a little bit about what Claire spoke to us about before. So it's not that they're specialists in drugs, they're specialists in how drugs affect us as humans, how they affect our biology, how they affect our physical capabilities. So it's not just, I know everything about drugs. I know what this will do to you and why it's
Yes.
doing that. And I think that's the bit we
Doing
need to
that, you're
think.
doing it different.
You
Yeah,
know, your
that's exactly
knowledge
it.
of the body, the knowledge of the human response to a drug is probably more than most GPs. That's why GPs ask you what, you know, and working together, you get the outcome.
Yeah, and I think it comes back to that thing about questions. If it's not working the way you want it, have a quick chat to the pharmacist, because it may be that by taking it an hour later after you've had your breakfast, or at a different point in the day, or with something else, that it will work better for you. So, yeah, use the expertise that your pharmacist has. Ask the questions, but I keep coming back to the same thing. Don't leave it to the last minute. So many men will send their wife in to get stuff for them because they're all going to the pharmacy anyway. And that's why I get all these random pictures of bits that I'm like, I don't even know what that is.
So I'm a typical lazy bloke. All right. So I would send someone else in to get my stuff because why would I go? I'm not going to do it. But I remember I've known Claire quite a long time. And I remember I've got an underactive thyroid, so I'm on something like thyroxine or something. And I was talking to her about those, and I'm taking a couple of other pills for other things. And Claire's lovely until she's not. Um, and she gave me a right rollicking about just taking all my tablets at the same time because I didn't know, and nobody had ever told me that I need to take my thyroxine at a completely different time to anything else and on an empty stomach before. So she told me exactly what I should do and how to do it. And since then, which was a number of years ago, I've been very well behaved and get up and take my thyroxine on an empty stomach. But Claire gave me a right thing. But the doctor never told me that. My pharmacy at the time, which I'm not with, and now I just get delivered, just deliver it. But they would have said, and it was Claire who put me straight about how to make it really effective, to make my drugs work. And it was that take it at a different time made me think about that. But actually having that conversation with a pharmacist and, you know, enabled my drugs to be very efficient and effective compared to the way I was taking them. They was probably working, but they were better because I was taking them appropriately and properly.
Yeah, probably let you have a slightly lower dose so that you actually absorbed all the dose that you needed rather than having a much higher dose that you wasted half of. So yeah, that's a
You
great
never told me
example.
that, you just shouted at me.
I'm not that scary.
All right.
Because you don't shout at anyone, do you, Gary?
Never have.
Yeah.
Never.
So we're coming to the end of the podcast. I have just a very quick question first before I kind of hand back over to you, Claire. And that question is pharmacy first, because I don't think the advertising campaign is great. And I know you touched on it, that you said you can go for earaches and other bits. What actually does pharmacy first do? What can I, as a man, come to you and say, I need a prescription or I need some advice on this? What does pharmacy first help me with that?
Pharmacy first is meant to, I mean, I don't like the phrase take the pressure off for GPs because they have a real role to do, but I think it's about shifting access. That's the nicer thing, because it's been very frustrating as a pharmacist to know exactly what you might need, but not be in a position to be able to supply it, knowing that it's going to take you a while to get it. So Pharmacy First aims to shift the ease of access for some common conditions. So if you have shingles, if you have a sinusitis, if you have an infected insect bite, all of you could come into the pharmacy, show us the appropriate body part. We do an assessment and say, okay, that's all right for the minute, keep an eye on it, but come back if it doesn't get any better. Or we might say, yeah, that definitely needs antibiotics. Here is your antibiotics. Here is how you take them. If it's no better in a week, come back and we'll reassess. So it's aimed at improving that. But there's also an add-on for children, which is for middle ear issues that you can have. There is a little section for urinary tract infections in women that you can do. But there's all sorts of issues that we can now prescribe for. So sinusitis, sore throats, infected insect bites and shingles. You just walk into a pharmacy and within the space of 10 minutes, you could walk out with an antibiotic that would have taken you maybe 3 or 4 days to get from the GP. So it's bringing me back to that early access point of don't leave it too late. If your insect bite is looking a bit red, sore and itchy and it's swollen, don't just put up with it. You can get that sorted, and you can get it sorted sooner rather than later, which I think is a brilliant idea.
Amazing. Thank you. And then finally, Claire, where can people find you? Where can people find you from a hypnotherapy perspective? Where can people find you if they want to come and talk to you from a pharmaceutical perspective?
Yeah, form an orderly queue outside Gravesend Regent Pharmacy on a Wednesday. That's my regular spot, and I will be there happily dispensing prescriptions and chatting to everybody on a Wednesday. But the rest of the time, you can find me at claire@inspiredtochange.biz, where I work from Maidstone. My practice, as you guys will know, but not everybody else will, is solution-focused hypnotherapy, principally working with people who want to reduce their dependence on medication. That could be something recreational, it could be something like pain, it could be wanting to give up antidepressants and empower yourself to do without them. That's something that I love working with. But I also have a specialism in working with neurodiversity. So children, adults, young people with a neurodivergent diagnosis, helping them to cope better with life and everything in between. The variation is what I love about what we do.
Amazing. Thank you so much. I know that we could genuinely talk to you for hours and hours because you've got such a depth and breadth of knowledge, but thank you for sharing your experiences with us here today. We hope we haven't been too hard on you and that you've enjoyed the talk.
No, I've loved it. As I said, it's really nice to actually be on here because I've listened to you, and I love the vibe that you boys have as this. I think it's a really nice podcast to share with my male clients and those that I come across, because guys do talk. You just have to give them the right conditions and a slight kick to get them to do it properly. So yeah. Keep going.
So
Thank you.
goodbye from me, and yeah, I'll let everybody say their goodbyes.
Yeah, thank you. See you later. Speak soon.
Yeah, thank you, Claire, for coming on, and it's been fantastic as always to see you.
Thanks, Claire.
Thank you all. Bye from me.
So goodbye, and thank you very much, everybody. We'll catch you on the very next episode.